Who is the ideal demographic for making the switch, or who's going to benefit the most from switching over?
Now, physicians that are practicing longitudinal care, that wants to dedicate their practice to looking after a panel of patients. That is who it's most suited for. Now, if you're a physician who only works 2, 3 days a week and diversifies your time, let's say between long-term care and other aspects in the healthcare field, which a lot of physicians do, it may not be the most best program for you to go on. I do find that for your physicians that are working 5 days a week, that you are putting in that amount of time, that it really is a good opportunity for them to look at it. Now, with that being said, I have had some physicians that are full-time physicians that are such amazing billers that they have stayed on fee for service only for the sake of that their brains will work a little like a computer. They're a very small group, so their billing they didn't see quite an increase when they did an assessment related to it. But for anybody practicing longitudinal care, especially if you're working 4 or 5 days a week and you're putting in long hours, and if you have a large panel, that is another thing as well. A bigger panel, I find that it gives you the availability to be able to look at that, to look after them that little bit more without feeling like you're constrained to only the patients you've seen that day. So I do find that would be who I would recommend is more your longitudinal family physicians.
Okay, so those doctors, like bread and butter, classic family medicine, that is sort of the ideal demographic.
Yes, for that ideal, traditional, old school type of family medicine, yes, that's what I would recommend who it's for.